and I want to focus on the mouth and the lips. Looking at stage 43, why is her tongue sticking out, protruding between her lips?
In this photograph, that is not her tongue coming between her teeth. That's her lip. What we see going horizontally in this photograph is a full thickness laceration that has torn almost entirely through the lip and has almost separated this superficial most sort of layer of her lip from the rest of her lip. So admittedly, it does look like a tongue in this photograph, but it is simply just sort of that upper rim of her lips.
I apologize. Thank you. And states. Oh, and you had mentioned earlier from the top of page 2, is this the perforation you had mentioned in your top paragraph?
It is. That's the laceration that goes all the way through, outside to inside, to the upper lip.
Same out of states 39. And so that is the inside of her lip.
Sort of inside or the crown of the lip, however you might call it. It's the vermilion part of the lip. It's that delicate pink part that becomes flushed when we're embarrassed or what have you. Generally speaking, a good way to maybe define it is it's the part of the lip that lipstick is applied to. And so there's a laceration right at that border between the sort of ordinary skin and that part of the lip.
States 52. What is states 52 showing us?
This is a photograph of that lip reflected. And now in this photo, we do see the tip of the tongue. It's right there at the teeth. But this photograph is to show the large gaping laceration through that part of the lip and demonstrating the extent to which it's torn open.
And right here where I have my pen, what are these? Are teeth?
Those are teeth, yes, sir.
Lower teeth?
Yes, sir. And then the what appears white in this photograph is her gingiva or the gums where the teeth are.
And this here is, what is this that I've now circled on states 52?
That's the tip of the tongue.
All right, so this is tongue.
Yes, sir.
Okay. States 50.
And this photograph is still the lower lip, but now demonstrating more the left side and inside left side of the lower lip where there's hemorrhage into that tissue coming from the laceration.
Okay, and we've discussed our teeth under here. This is what?
That's the tip of the tongue.
And so are these our top teeth on top of that?
Yes, sir. Just peeking out from beneath her upper lip.
Does this picture suggest that the tongue is trapped between our upper and lower teeth?
It is.
States 51. What is shown in states 51?
This is the upper lip reflected with the forceps and a gloved hand, showing several lacerations across the inside of the upper lip.
And on the lower lip, you call that a tearing of the fascia?
No, not the fascia. Just that intermucosal surface of the lip.
Okay. And again, states 38. What's visible off of states 38? What,
This is a photograph of the left side of the decedent's face, chin, neck. You'll see at the top of the photograph is her left external ear for orientation purposes. Her mouth is here, sort of in the lower left side of the photo. What we're seeing is several abrasions and contusions that are across the left side of her neck, kind of in a horizontal pattern. And we can also make out in the area that's sort of just on the front base of the neck, in that sternal notch, we can see some abrasion there too.
what is this discoloration down here underneath the neck?
Yeah, that's the abrasion I was just referring to, scraping of the skin.
And the redness on the left cheek and face?
All right, bruising and abrasions or scrapes of the skin on that left edge of the mandible that we're seeing and extending onto the left side of the neck.
Stage 36.
This is a photograph taken from the front as she's lying on her back. Again, it's showing that abrasion or scraping of the skin on the front base of her neck.
And from your experience, what is the mechanism of injury to cause that type of abrasion?
Yeah, the skin has been scraped by a blunt object of some sort. Combined with the bruising on the neck and the peaking on the eyes, these are all injuries consistent with a strangulation, a compression of the neck.
Stage 37. Do you see that same type of injury from the right side of her neck?
Yes, this photograph is kind of the right shoulder, right upper chest area. And the center upper portion of the photograph, we can see this abrasion again on the front side of the neck for orientation purposes. We can see in this right side of the upper chest, over the right clavicle, there's purple bruising with some scraping of the skin. Another small little scrape of the skin a little further down on the chest. We see a little bit of contusion sort of on the apex of that right shoulder. And even at the upper center of the photo, we can see sort of a curvilinear red bruising that was on the right side of the neck, sort of under the right side of the jawline.
Stage 41.
This is a photograph of the right side of her face. We can most obviously make out her right external ear, which is on the left side, left center of the photo. It has been scraped over. You see sort of the apexes are scraped, whereas the deeper portions are not so much. It tells us that she scraped over a surface, or a surface scraped over her. That abrasion continues onto the right side of the face, just in front of the right ear. And we see another abrasion a little further down toward the jawline. The right side of the face is mostly occupied by a purple-red contusion that you can see there amidst those abrasions. And we see some generally horizontal linear abrasions and contusions that sort of stream from over the right side of the face across the mandibular line or the jawline and onto the right side of the upper neck.
Okay. And the pictures that we just published, is all of that encapsulated on page 2 of your report?
There are some of those injuries are documented on page 3 as well, but most are on page 2.
Okay. So just off those injuries that we've seen published and on and that you've described on page 2, overall, what would cause those visual injuries?
Blunt impacts to the face, to the neck, to the upper chest, as well as compression or strangulation with compression of the neck structures.
Going to page 3 of your report, you turn to the trunk of the body. What did you find at the trunk of the body?
Well, externally, I saw that the right shoulder had pink contusion near the base of the neck, and there was another pink contusion over the right clavicle, as we saw in the photographs, and then a small little pinpoint abrasion near the sternum.
And I apologize. If you would, what did you observe looking from the base, the last sentence on page 2 through the top paragraph of page 3? What did you observe?
There were vascular dissections. I dissected out the blood vessels of the neck and saw that there were lacerations or tears of the internal jugular veins at their inferior regions, close to where they come out of the neck. Both of those had been torn. And there was hemorrhage into the tissue around the seventh cervical vertebra. That is the vertebra that you can sort of feel, the most prominent one there at the bottom of the neck, going down your back. That vertebra had been fractured and was had a stair step configuration, is what we call it, with the vertebra below it, which is the first thoracic vertebra. So it had been fractured and they had moved apart from each other and sort of had this stair step configuration after having been entirely fractured. Along with that fracture, the spinal cord that passes through that area was also fully transected or torn completely through. And there was hemorrhage in the spinal canal and in the muscles and tissue around the spine.
So what would be the effect of that type of injury, the stair step completely fractured and the spinal cord transected? Does that mean torn?
Yes, sir.
What would be the effect of that type of injury?
She would have been paralyzed from the lower neck down, from the shoulders down.
Looking through at injuries that you found in the trunk from below C7, what did you find?
Internally, I saw that the left first through eighth ribs and the right first through seventh ribs had hemorrhagic fractures. They were broken. There were broken ribs with hemorrhage around them, around the fracture sites. The soft tissue of the center of the chest had hemorrhage in that tissue around the around the spine. The left chest cavity held about 380 milliliters of blood, and the right chest cavity had approximately 260 milliliters of blood. And then the front edge of the liver, which sits kind of in the upper left side of the abdominal cavity, it had a small laceration as well.
So it would be fair to say she had 15 rib fractures.
Yes, sir.
From your experience, what would be the mechanism of injury to cause that many rib fractures at a time?
A heavy force was directed onto her chest that compressed the center of her chest inward and caused those ribs then to buckle and fracture.
From your experience, would 340 pounds be sufficient force on the chest and torso of a 75-year-old woman?
Yes.
From looking at, give me the previous pictures. And beyond may I approach the witness, Sharon?
Yes.
Does your report, beyond the pictures you take and the reports you write, do you also produce a graphic overlay of the body that summarizes the injuries?
I do.
showing you what is marked as state's exhibits numbers 54 and 55 for identification. What are states 54 and 55 for identification?
These are what we call injury diagrams. They're sort of a generic outline of, on one page on exhibit 54 is the outline of a human head, face, and then on 55 is the outline of an entire human body. And we use these just to sketch out the injuries to make it easy to refer to them.
Okay, and so would it be accurate to say that 54, the head injuries, and these, you annotated these once on 54?
I created that, yes, sir.
Okay. Would it be fair to say that 54 and 55, the diagram, show what we've gone over in detail with the previous pictures that you documented the actual injuries?
Yes.
All right. Tender states 54 and 55 to defense for inspection and move to introduce 54 and 55 into evidence.
No objections.
And what numbers were those?
54 and 55.
All right, state's exhibits 54 and 55 are admitted without objection.
So, doctor, with what the injuries you observed in the trunk with the 15 rib fractures and all the abrasions to the left side of Miss Boyd's face. Now, I previously asked if someone approximately 340 pounds sitting on or straddling her chest or however that could cause the 15 rib fractures. Do the blows to her left side of the face, if they were facing their assailant, that indicates somebody striking with the right hand? Is that possible?
That's possible, yes.
Aside from documenting evidence of injury, both internal and external, what else do you do in the process of completing your autopsy?
We'll still conduct an entire internal examination, complete the rest of the autopsy and document whatever sorts of natural diseases are present as well.
Did you find any evidence of natural disease or anything that could have contributed to Miss Boyd's death? Anything so acute that it would have contributed to her death?
She had hypertensive and atherosclerotic cardiovascular disease, which is quite mild. She did not even have an enlarged heart, just a minimal, mild narrowing of the coronary arteries. But none of it was to such a degree that she would be expected to have died of natural diseases anytime soon.
Aside from the examination, did you also collect any evidence from the body?
I did.
And what type of evidence do you collect?
So we collected the fingernail clippings from both hands that we mentioned before. Also a sexual assault kit, which includes combed pubic hair combings, known pubic hair standard that we plucked. Also the same combed scalp hair and pulled known samples of scalp hair, we saved those. And then swabs of the oral, vaginal, and rectal cavity.